Xanax is a widely prescribed medication with a significant impact on mental health. Whether you're familiar with it or not, understanding the uses, benefits, side effects, dosage, and risks associated with Xanax is crucial. This video dives deep into the world of Xanax, shedding light on its multifaceted nature and providing you with the knowledge necessary to make informed decisions. As a popular anti-anxiety medication, Xanax is primarily used to treat panic disorder and anxiety disorders. It belongs to a class of drugs called benzodiazepines, which work by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain. Known for its fast-acting properties, Xanax can help manage symptoms of anxiety and allow individuals to regain control over their lives. While Xanax can be beneficial for many, it is essential to understand the potential side effects and risks associated with its use. This video takes a comprehensive look at the dosage recommendations, potential adverse effects, and precautions to be aware of when using Xanax. Stay informed and make educated decisions about your mental health. Read on to discover the ins and outs of Xanax, the uses, benefits, side effects, dosage, and risks explained. What is Xanax used for? Xanax, a widely prescribed medication, is primarily used for the treatment of panic disorder and anxiety disorders. It belongs to a class of drugs called benzodiazepines, which work by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain. GABA is responsible for inhibitory signaling in the brain, helping to reduce feelings of anxiety and promote relaxation. Xanax is known for its fast-acting properties, making it a popular choice for individuals seeking immediate relief from anxiety symptoms. Xanax can be highly effective in managing panic disorder, which is characterized by recurring panic attacks. These attacks are sudden and intense, typically accompanied by physical symptoms such as a rapid heart rate, shortness of breath, and sweating. Xanax helps to alleviate these symptoms, allowing individuals to regain control over their lives and reduce the frequency and severity of panic attacks. In addition to panic disorder, Xanax is also used to treat various anxiety disorders, including generalized anxiety disorder, GAD, social anxiety disorder, SAD, and specific phobias. GAD is characterized by excessive and uncontrollable worry about everyday events and activities, while SAD involves intense fear and avoidance of social situations. Xanax can help individuals with these conditions manage their symptoms and improve their overall quality of life. Benefits of using Xanax. One of the primary benefits of using Xanax is its fast-acting nature. When taken as prescribed, Xanax can provide rapid relief from symptoms of anxiety, allowing individuals to feel calmer and more relaxed. This quick onset of action makes it particularly useful in situations where immediate relief is needed, such as during a panic attack or when facing a particularly anxiety-inducing event. Xanax can also help improve sleep quality for individuals suffering from anxiety-related insomnia. By reducing anxiety levels, Xanax promotes relaxation and can aid in falling asleep faster and achieving a more restful sleep. Improved sleep can have a positive impact on overall mental well-being, as it allows the body and mind to rest and recharge. Furthermore, Xanax can help individuals regain control over their lives by reducing anxiety symptoms that may be interfering with daily activities and social interactions. With reduced anxiety levels, individuals may feel more confident, better able to cope with stress, and enjoy a better quality of life. However, it is important to note that while Xanax can be highly beneficial for many individuals, it is not a long-term solution for managing anxiety. It is generally recommended for short-term use, typically up to 2-4 weeks, to avoid the risk of dependence and tolerance. Common side effects of Xanax. Like any medication, Xanax has potential side effects that individuals should be aware of. While not everyone will experience side effects, it is important to discuss potential risks with a healthcare provider before starting Xanax. Common side effects of Xanax can include drowsiness and fatigue. Xanax can cause drowsiness and may impair cognitive and motor skills. It is important to avoid activities that require alertness, such as driving or operating machinery, until the effects of Xanax are fully understood. Memory problems. Some individuals may experience memory problems or difficulty concentrating while taking Xanax. This side effect is typically mild and reversible once the medication is discontinued. Dizziness and lightheadedness. Xanax can cause dizziness and lightheadedness, especially when standing up quickly from a seated or lying position. It is important to take precautions to prevent falls and injuries. Dry mouth. Xanax can cause a dry mouth, which can be alleviated by staying hydrated and using sugar-free gum or lozenges. Changes in appetite. Some individuals may experience changes in appetite while taking Xanax. This can manifest as an increase or decrease in appetite. It is important to maintain a balanced diet and monitor any significant changes in weight. Sexual dysfunction. Xanax can occasionally cause sexual dysfunction, such as decreased libido or difficulty achieving orgasm. It is important to discuss any concerns with a healthcare provider. These side effects are generally mild and temporary, but if they persist or worsen, it is important to seek medical advice. Additionally, there are rare but serious side effects associated with Xanax, such as allergic reactions, hallucinations, and suicidal thoughts. If any of these occur, immediate medical attention should be sought. Dosage guidelines for Xanax. The dosage of Xanax prescribed will vary depending on the individual's specific condition, severity of symptoms, and response to the medication. It is important to follow the dosage instructions provided by a healthcare provider and not exceed the recommended dose. Taking higher doses or using Xanax for longer than prescribed can increase the risk of side effects and dependence. Xanax is available in immediate-release tablets and extended-release tablets. Immediate-release tablets are typically taken 2-4 times a day, while extended-release tablets are taken once daily. The dosage may be adjusted over time to achieve the desired therapeutic effect. It is important to take Xanax exactly as prescribed, at the same times each day, to maintain a consistent blood level of the medication. The starting dose of Xanax for anxiety disorders is generally 0.25-0.5 mg, taken 3 times daily. The dose may be increased gradually if necessary, under the supervision of a healthcare provider. For panic disorder, the starting dose is typically 0.5 mg, taken 3 times daily, although it may be adjusted based on individual response. It is important to note that abrupt discontinuation of Xanax can lead to withdrawal symptoms, including rebound anxiety, insomnia, irritability, and seizures. Therefore, it is essential to consult with a healthcare provider before stopping Xanax or reducing the dosage. They will provide guidance on how to safely taper off the medication to minimize withdrawal symptoms. Risks and precautions of taking Xanax. While Xanax can be an effective medication for managing anxiety, there are several risks and precautions that individuals should be aware of. These include dependence and addiction. Xanax belongs to a class of drugs called benzodiazepines, which have the potential for dependence and addiction. Prolonged use or misuse of Xanax can lead to physical and psychological dependence. It is important to follow the prescribed dosage and duration and not exceed the recommended use. Withdrawal symptoms. Abrupt discontinuation of Xanax can lead to withdrawal symptoms, including rebound anxiety, insomnia, irritability, and seizures. It is important to work with a healthcare provider to gradually taper off the medication to minimize withdrawal symptoms. Drug interactions. Xanax can interact with other medications, including prescription drugs, over-the-counter medications, and herbal supplements. It is important to inform a healthcare provider about all medications and supplements being taken to avoid potential interactions. Pregnancy and breastfeeding. Xanax should be used with caution during pregnancy and breastfeeding, as it can pass through the placenta and breast milk. It is important to discuss the risks and benefits with a healthcare provider before using Xanax in these situations. Pre-existing medical conditions. Xanax may not be suitable for individuals with certain medical conditions, such as liver or kidney disease, respiratory disorders, or a history of substance abuse. It is important to disclose all medical history to a healthcare provider before starting Xanax. Alcohol and other depressants. Xanax should not be combined with alcohol or other depressant substances, as this can increase the risk of sedation, respiratory depression, and overdose. It is important to avoid alcohol and consult a healthcare provider before using Xanax with other medications or substances. It is crucial to discuss any concerns or questions with a healthcare provider before starting or continuing Xanax. They can provide personalized guidance and monitor for any potential risks or adverse effects. Alternative treatments for anxiety. While Xanax can be effective for managing anxiety, it is not the only treatment option available. For individuals who prefer non-medication approaches or are looking for additional strategies to complement medication, there are alternative treatments to consider. These include therapy. Cognitive behavioral therapy, CBT, is a type of therapy that focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. It can be highly effective in managing anxiety disorders and panic disorder. Other types of therapy, such as exposure therapy and relaxation techniques, may also be beneficial. Lifestyle changes. Making lifestyle changes can have a positive impact on anxiety levels. Regular exercise, a healthy diet, adequate sleep, and stress management techniques, such as mindfulness or meditation, can all help reduce anxiety symptoms. Support groups. Joining a support group or seeking peer support can provide a sense of community and understanding. Sharing experiences and coping strategies with others who have similar challenges can be empowering and help reduce feelings of isolation. Herbal supplements. Some individuals find relief from anxiety symptoms through the use of herbal supplements, such as lavender, chamomile, or passion flower. It is important to consult with a healthcare provider before starting any herbal supplements, as they can interact with medications and have potential side effects. Relaxation techniques. Practicing relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, or guided imagery, can help reduce anxiety and promote a sense of calm. These techniques can be learned and practiced independently or with the guidance of a therapist. It is important to discuss alternative treatments with a healthcare provider to ensure they are safe and appropriate for individual circumstances. They can provide guidance on incorporating these treatments into a comprehensive anxiety management plan. How to safely use Xanax. To ensure the safe and effective use of Xanax, it is important to follow these guidelines. Consult a healthcare provider. Before starting Xanax, it is important to consult with a healthcare provider who can assess individual needs and provide appropriate recommendations. They will determine the appropriate dosage, duration, and monitor for any potential risks or side effects. Follow the prescribed dosage. Take Xanax exactly as prescribed by a healthcare provider. Do not exceed the recommended dose or take it for longer than prescribed. Taking higher doses or using Xanax for longer than recommended can increase the risk of side effects and dependence. Avoid alcohol and other depressants. Xanax should not be combined with alcohol or other depressant substances, as this can increase the risk of sedation, respiratory depression, and overdose. It is important to avoid alcohol and consult a healthcare provider before using Xanax with other medications or substances. Be aware of potential side effects. Familiarize yourself with the common side effects of Xanax and monitor for any changes or adverse reactions. If any side effects persist or worsen, consult a healthcare provider for further guidance. Do not abruptly discontinue Xanax. Abrupt discontinuation of Xanax can lead to withdrawal symptoms. It is important to work with a healthcare provider to gradually taper off the medication when it is no longer needed. Store Xanax safely. Keep Xanax out of reach of children and pets. Store it in a cool, dry place away from direct sunlight and moisture. Keep healthcare providers informed. Inform all healthcare providers, including dentists and specialists, about the use of Xanax to avoid potential interactions with other medications or treatments. By following these guidelines, individuals can safely and effectively use Xanax to manage their anxiety symptoms. Seeking professional guidance for Xanax use. Managing anxiety and making decisions about medication use can be complex. It is important to seek professional guidance when considering or using Xanax. A healthcare provider, such as a primary care physician or psychiatrist, can assess individual needs, discuss treatment options, and monitor the effectiveness and safety of Xanax use. During consultations with a healthcare provider, it is important to provide accurate information about medical history, current medications, and any concerns or questions. This will help ensure that the prescribed treatment plan is tailored to individual needs and minimizes potential risks or interactions. Additionally, individuals should not hesitate to seek support from mental health professionals, such as therapists or counselors, who can provide additional strategies for managing anxiety and support throughout the treatment process. Combining medication with therapy can often lead to more comprehensive and effective outcomes. Communication with healthcare providers should be ongoing, as individual needs may change over time. Regular check-ins and open dialogue will help ensure that the treatment plan remains appropriate and effective. Conclusion: understanding the uses and risks of Xanax. Xanax is a widely prescribed medication used to treat panic disorder and anxiety disorders. It can provide rapid relief from anxiety symptoms, allowing individuals to regain control over their lives. However, it is important to understand the potential risks and side effects associated with Xanax use. By following the prescribed dosage, being aware of potential side effects, and seeking professional guidance, individuals can safely and effectively use Xanax to manage their anxiety symptoms. It is also important to consider alternative treatments and lifestyle changes that can complement medication use and promote overall mental well-being. Remember, your mental health is important, and being informed about the uses, benefits, side effects, dosage, and risks of Xanax will help you make educated decisions about your treatment options. Consult with a healthcare provider to determine the best approach for managing your anxiety, and always prioritize open communication and self-care.